en entrevista para Dime por qué, la raíz del cáncer. El cáncer nos puede tocar a todos. Ella nos va a contar su historia con el cáncer. Maria, I know your story about how cancer touched your life, but I want people to know your story on your own words. In the first place, what is your name?
My name is Maria Eli. I'm the wife of Claudio Ortiz. He's currently being diagnosed with cancer, and we're having a hard time dealing with all the issues around his cancer diagnosis. The cancer is in his spine. It has spread to his lungs, and I'm really sad about it. He is supposed to have a appointment coming up on the 1st of October for chemotherapy, and we're just hoping and praying that he can enter into remission. Tonight he seems very, very fatigued, and I'm really concerned about him. His strength is weakening every day, and I'm just praying that God will give us the strength to continue to make it through these few days, and hopefully he can go into remission.
Maria, when Claudio was diagnosed and with what kind of cancer he was diagnosed?
He was diagnosed with squamous cell carcinoma, undifferentiated. They were not sure of where the primary site was.
When was that?
That was in May of last year. That's when the diagnosis was. He had a swelling in his neck, and when they did a biopsy, they found that it was cancer.
Okay. And at the time he was diagnosed with the cancer, that is, what is the type of cancer again?
It was a metastatic squamous cell carcinoma, undifferentiated.
Okay. So you're saying that he was diagnosed in May last year,
Mm-hmm.
and since that moment, what happened?
Well, after he was diagnosed, he went under a series of radiation and chemotherapy.
How many radiations Claudio was exposed to?
I don't remember the number he was exposed to. I don't fully remember the amount of radiations he was exposed to. I don't remember, yeah. But it did seem like he entered into remission after the treatment was completed.
For how long he was under remission?
Probably like a couple of months afterwards. All his results appeared to be normal, but within probably, I would say, like a year or so, he started to have mild back pain. And when he went to the doctor, he didn't go to his oncologist, but they said it was muscle spasms. He was diagnosed with muscle spasms, but it started to get worse. And that's when I feared that it was something more serious going on with him.
Why you notice that? What is the difference between other people and you? You have a kind of knowledge because you're what?
Well, I have a medical background, so I can tell that it was more than just a muscle spasm. He was unable to urinate at that point, and the pain had become so severe that it was affecting how he walked, and it was limiting him in terms of his mobility. and I tried to convince him to go back to the oncologist to get checked.
And in that check, what happened?
The oncologist feared that he probably had a tumor somewhere in his spine that was compressing that area and affecting certain functions like the ability to urinate. But the fear was that maybe this tumor was cancer.
Okay. And you were mentioning um that is having lack of breathing. What is that about, and what is that attached to the cancer?
Sometimes since he's been diagnosed with cancer, he's been diagnosed with cancer in his spine and it has spread to his lungs. He has developed panic attacks, and sometimes he thinks of death and he is unable to breathe. He has like a increased heart rate and difficulty breathing. He starts panicking. So he's developed a series of panic attacks that comes on suddenly.
And what is his feeding? What about his feeding? He's
His
he's eating well, or
his
what's going on?
appetite is not very well. He's eating less, and as each day go by, he tries to eat, but he has a lack of appetite. So I always tend to force him to try to eat, but he eats very little amounts. He's on protein supplements, and sometimes he eats small amounts of food. I try to make the foods as proteinous as I can for him.
Okay. And how much weight he has been losing since he was diagnosed?
Well, he has lost a total of 88 pounds, and he was 220 pounds. I fear that he has lost a little bit more since, between last week and this week. Yeah.
So after the relapse, he's going down in his weight.
Yes, he is.
Okay. And he's able to walk, or he needs help to walk?
Well, he can walk with a walker. Without the walker, it is difficult because he has severe muscle weakness. He has actually fallen 3 different times, even on the walker. So as each day progresses, his weakness increases. But he tries because he knows the exercise is good for his legs, but without a walker, he cannot do it.
Okay, Maria. And you were saying that he's soon going to receive a chemotherapy that is an IV chemotherapy, right? Or I'm
Yes.
wrong?
Yes, I believe it is IV chemotherapy.
Okay, and during that time, prior this appointment that you finally got after being trying to do one
It's
So-
been a while.
for a while, okay, what kind of medications he's in right now?
The ones that he's using right now,
Mm-hmm.
he's using a series of medications right now. He's on steroids. He's also diabetic. He's on metformin, glipizide. From the previous radiotherapy and chemotherapy, his thyroid gland was damaged, so he's on thyroid hormones as well. So he's taking a series of medications, especially for pain. But he still has a lot of pain. Yeah.
And we both know this information because you are a student of
Southwest Tennessee Community College.
for become what?
I'm studying nursing as well.
So that is why you can notice his lack of breathing. You're able to take his pressure.
Yes.
Okay, and you already know that he's in steroids. What else about the steroids he's going? It's just the rest of the pills are just for the pain, or it is part of the treatment of the cancer?
Well, the steroids are to relieve compression on the spinal cord because, he still have compression, the nerves, and that contributes to swelling in his lower extremities. The problem with the steroids is controlling his blood sugar. He is a diabetic, and the blood sugar tends to become higher while he's on the steroids. They're hoping that with the chemotherapy, it can further relieve some of the pressure on the spine with the remaining tumor that he has there. So,
Let's talk about you. You're the caregiver. And tell me about it. Tell me about your kids. Tell me about the school. Tell me about your days during this last year.
it is hard. I don't have family here, so it's just me and my two kids. I'm actually from Barbados, so I'm a long way from home, trying to manage him. I do before and after care for the kids. I go to classes in the afternoon. I try to take care of him in the morning. I leave him here with the kids, and then when I come back, I continue to take care of him. So it's kind of hectic, basically. It's a lot of running around. He has appointments. I have to take him there. So basically, my day is hectic. It's very hectic.
And your kids, they're both fine, or what happened with one of them?
So one of my kids is autistic. He's 11 years old. He receives therapy at the school for occupational and speech therapy. But there are days we have hard times with him, and then there are days it's not as bad. So I pretty much have my hands full.
What type of autism he have?
They just diagnosed him with autism and ADHD as well, but he's doing better. He's unable to go back and forth for the conversation with me, but he's still able to express himself as to tell me what he wants. So I'm hoping as time go by, he'll become more expressive.
So you have a big load in your arms right now.
Yes.
You're dealing with a lot of stuff. How do you feel about it?
I feel overwhelmed, scared. Yeah.
And what are you sticking to? What does your strength come from?
From God. Yeah, from God. I just try to take it one day at a time.
That's all we do, Maria.
Yeah.
All the warriors in cancer and the caregivers, through this interview, can be concerned that when cancer touch not directly to a person, all the family suffers too. So I really appreciate your time for this foundation that is regarding concerning people about cancer can touch anyone's life, no matter what. And we're trying to reach out people to let them know the reality behind the life of the family of a warrior of cancer and the life of a warrior of cancer himself. So thank you for this interview. I really honor all the things you do. I was able to see it, and I'm grateful that I could be here for you to carry this burden that is not easy, and to be part of your life and the life of your family. So thank you for your interview. I know that we're going to touch a lot of hearts out there, and they gonna learn from you how to handle if cancer touches your family. So thank you very much for your interview and your time. So, María, dime por qué la raíz del cáncer.